Guide to Health Insurance in Serbia for Foreigners for 2026. If you are moving or living in Serbia, navigating the healthcare system is a priority. Here is everything you need to know about public versus private options. Public health insurance. The public system is managed by the National Health Insurance Fund, and it is based on a principle of solidarity, where contributions are mandatory for employees and voluntary for others. Who is eligible? Employed foreigners. If you are legally employed by a Serbian company, your employer pays these contributions automatically. Self-employed or entrepreneurs. If you have your own Preduzetnik agency or your own company in Serbia, you are eligible for the insurance. Voluntary basis. Any foreigner with a valid temporary residence can buy into the state fund. Bilateral agreements. Citizens of countries like Germany, Austria, Montenegro, etc. may be covered through agreements between their home country and Serbia. Check your country's status with Serbia National Fund. The cost. For those paying voluntarily, not through employment, the monthly contribution for 2026 would approximately be around 5,284 dinar. How to get it? You must visit the local National Health Insurance Fund branch in the municipality where you are registered. Documents needed. Passport, proof of residence, this would be white card or sticker, and often a certificate from your home country stating you don't have active insurance there. Also, they will ask you for the proof of employment or something else that your health insurance needs to be based on. You cannot just buy it. In order to do this, you will need to go to the PO office and submit all these documents. What are the benefits of having a Serbian public health insurance? It covers emergency care, specialist visits, and surgeries in state hospitals. Also, it's subsidized prescription medications, though not for all the medications. Public insurance is also necessary for long-term sick leave or maternity benefits if you are employed. Now, let's see the breakdown of advantages and disadvantages of using a public health system in Serbia. The pros: comprehensive coverage. It is the only insurance that covers absolutely everything, including major surgeries, complex chronic conditions, and long-term treatments that private insurance usually excludes. Then, no pre-existing condition exclusions, which means, unlike private plans, the state fund must accept you regardless of your medical history. It's affordable. The price is fixed. It's around 5,300 Serbian dinar for 2006 per month. It does not increase based on your age or health risks. Also, subsidized meds. Most essential medications are either free or significantly discounted at pharmacies with the state prescriptions. Disadvantages. Bureaucracy. Navigating the state system often requires patience, Serbian language skills, and dealing with the paper. Also, you will need some good negotiation skills. Long wait times. For non-emergency procedures, specialized scans like MRI or certain specialists, you might wait weeks or even months. In reality, we're talking about months. Basic facilities. State clinics, Dom zdravlja, and hospitals are often crowded, and the facilities can feel outdated compared to the Western standards. Now let's talk about private health insurance. The benefits would be efficiency and speed. You can usually book a specialist appointment or a diagnostic test for the same or the next day. English friendly. Most private clinics have English-speaking staff and doctors, and insurance call centers often have dedicated lines for expats, which you can definitely not say for public hospitals. Comfort. The environment is modern, clean, and much more like a private hotel than a hospital. Direct access. You don't need a referral from a general practitioner to see a specialist. You just call and book. The disadvantages. Selective coverage. Private insurers almost never cover pre-existing conditions or very expensive long-term treatments like chemotherapy or major organ transplants. Cost. Premiums are higher and generally increase as you get older. Limited emergency care. In the event of a severe, life-threatening accident or major trauma, private clinics will almost always refer you to the state-run emergency center, Urgentni Centar, as they have the best equipment for critical care. Then what would be the optimal solution? The most recommended setup for foreigners in Serbia would be the hybrid approach, which means maintain your public insurance and also get a private add-on. Use your public insurance as safety net for major medical emergencies, surgeries, or chronic issues. It is also the most reliable proof of insurance for your residency renewals. Use a private policy for your routine health needs, flu, minor infections, lab work, and specialist consultations. This ensures you get high-quality service quickly without the stress of long queues. And here is one insider tip from me that internet won't tell you. All the best doctors in Serbia work in public hospitals. While most of them also offer services through private clinics, their availability there is often limited. Furthermore, if you see a specialist privately and complications arise, or if you need surgery or advanced diagnostic, having public insurance is a massive advantage. It allows you to be treated or operated by the same top-tier doctor in the public system, as many of them do not perform surgeries in private hospitals.